Hello, my name is Dr. April Baller and I work at WHO in the Health Emergency Department. Today we're going to be discussing when and how to wear a medical mask. By the end of this session, you will be able to summarize when you should use a medical mask, describe each of the steps of putting on a medical mask, and list the steps to taking off a medical mask. So our key questions for today are: when do you put on a medical mask? How do you put it on? And how do you take off a medical mask? To answer the first question, when to put on a medical mask, there are three different scenarios. First scenario is during a mission if you develop respiratory symptoms such as coughing or fever. Second, if you are in close proximity, that means less than 1 meter, with somebody else who has a respiratory symptom. And third, if you are on a mission to a country with an acute respiratory infection outbreak and you are expected to visit health facilities with patients who have respiratory symptoms. Please note, for staff whose mission terms of reference include providing direct patient care, should always contact the clinical management and IPC focal points for specific briefings. So, what are the key steps to putting on a medical mask? There are 6 key steps. The first one is, before you touch the mask, you should wash your hands with alcohol-based hand rub, if your hands are not visibly soiled, for 20 to 30 seconds, or soap and water if your hands are visibly soiled, for approximately 40 to 60 seconds. The second step, take a face mask and inspect it for any tears or holes. Third step, orient which side is the top side of the mask. This is the side of the mask where the metal strip is. Fourth step, ensure the proper side of the mask faces outwards. Usually this is the colored side. So the color side on the outside and the white side on the inside. So step 5, place the mask to your face. Pinch the metal strip or stiff edge of the mask so it molds to the shape of your nose, and place the elastic loops behind your ears. And the final step, pull down the mask's bottom so it covers your mouth and your chin. Now that you have put a mask on, how do you actually take it off? To take off the mask, remove the elastic loops from behind the ears while keeping the mask away from your face and clothes to avoid touching potentially contaminated surfaces of the mask. Afterwards, discard the medical mask immediately in a non-touch bin. And finally, perform hand hygiene using either alcohol-based hand rub or, if visibly soiled, wash your hands with soap and water. So, what do you remember? When should you use a medical mask? What distance is considered close proximity to a person with respiratory symptoms? And the final question is, how to put on a medical mask, take it off, and dispose of it. Thank you for watching this short but very important module on how to wear and dispose of medical masks. We look forward to seeing you in the next session.